And then I'm going to go ahead and share my screen and we'll jump in. All right, everyone. Okay, and it's going to, and now I can't see. Perfect. There we go. Okay, so thank you so much again, everyone, for joining us this afternoon. We're so happy to have you all here. We're going to, and now it's not showing me share settings. I want to see what I'm sharing, and it's not letting me do that. So I'm going to stop sharing and I'm going to share it again. Thanks for your patience. We're having a lot of technical difficulties today. There we go. Okay. And now is it gonna, there we go. So, real quick for our Zoom meeting here, just ask that everyone please mute your mics when you're not speaking. Whoop. And okay. And it's up to you if you want your camera on or off. And I'm trying to hide all of your lovely faces here. There we go. So now I can see the screen better. Perfect. And then if you feel comfortable, rename yourself to include your pronouns on your little Brady Bunch box there. And you can put questions and comments in the chat at any time. We always like to read the MPHA Ancestral Land Statement before we begin. So we ask that you take a moment to honor and acknowledge that we are on the ancestral homelands of the Dakota and the Anishinaabe. Indigenous people have a long-standing history and connection to the land since time immemorial and are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands, and because of aggressive and persistent settler colonialism and U.S. governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and the Anishinaabe people, ancestors, and descendants, as well as the land itself. Okay, so this morning, we're going to do a quick introduction to planetary health, and then we will have Tyler do an overview of the Planetary Health Task Force and where that came about and the work that we're doing there. And then we're going to have Dawn share a little bit about what the Planetary Health Task Force does, and then we'll have time for questions at the end. So, what is planetary health? So we'll talk about planetary health itself and the definition. We'll identify the local to global perspectives of planetary health, describe the health impacts of climate change. We're going to examine the relationship with social determinants of health and then identify public health's connection to planetary health. So, planetary health is a transdisciplinary movement addressing the anthropogenic changes of Earth's natural systems through solutions-oriented approaches. And it's an understanding of the interconnectedness of systems and how human-induced degradation of our planet affects the health of all beings. Planetary health acknowledges that centuries of racism and oppression have created inequitable effects for the most vulnerable populations, and it revisits traditional knowledge systems and diverse ways of knowing to align with the original environmental stewards of the land. So, many of you probably recognize the concepts on the left-hand side there. So, One Health, which you can see, we've got individual health, public health, global health, One Health, and then planetary health. So, One Health is incredibly important in public health because it helps us understand the interconnectedness of humans, animals, and environmental health, particularly related to infectious diseases and zoonotic transmission. Climate change is also a critical piece of this conversation, but similarly, climate change alone is not planetary health. So, simply put, planetary health widens the lens on both of these views here. It asks how human caused disruption to Earth's natural systems, including climate change, biodiversity loss, land use change, resource depletion, and environmental degradation collectively influence many things, including human health, healthcare systems, and health equity. And that system perspective matters because our health and public health is increasingly being affected by all of these interconnected pressures. So I like to put that planetary health simply widens the lens of our approach to all of our interconnectedness and how all of our health is interconnected. So, what do those
Oh,
effects look
I don't know.
like? One third.
Apologies to everyone. I don't know.
Hello? Can we make sure everybody is muted? Okay, so what do these effects look like? So humans are causing the planet to change. One third of all forests have been cleared. We're in the midst of the sixth great extinction, losing 75% of all species. The oceans, which act like our air conditioner, has absorbed 90% of the planet's warming in recent decades. There are estimates that say that Earth has lost a third of its arable land in the last 40 years. Microplastics have been found near the summit of Mount Everest and in the deepest parts of the ocean and in humans. 4 billion people, almost two-thirds of the world's population, experience severe water scarcity for at least 1 month each year. And we've really lost our connection to nature. And we're seeing this here in Minnesota too. We're seeing droughts, fires, extreme heat, flooding. Our winters are getting colder, our summers are getting hotter. So we are seeing these very localized effects of climate change and of planetary changes. And we're seeing how it affects our health. We are seeing how rising temperatures are causing things as simple as dehydration and as severe as heat stroke. Extreme heat affects people with underlying cardiac conditions as well. We're seeing these extreme weather events. We're seeing flooding and storms and droughts, and that is affecting, yes, property loss and infrastructure damage, but also water contamination as well. We're seeing more cases of waterborne illnesses, more cases of Legionnaire's disease. We see that a lot in areas that have had hurricanes and floods. Air quality, we're seeing an increase both in pollution. So we're seeing an
Great.
increase in ozone. So that is something we actually see in Minnesota as well. It's not just wildfire smoke, but also an increase in CO2 emissions. And that is affecting our respiratory health as well. And with changes in weather and precipitation and temperature, we're seeing a shift in vector-borne diseases as well. We're seeing more ticks, we're seeing more mosquitoes, and therefore we're seeing more of the diseases that those vectors carry as well. So we are seeing this in our everyday life, and we're seeing this as healthcare providers and public health practitioners as well. So this is something that is affecting the health of the populations that we serve, and it's affecting their health. It's also amplifying the stressors on their health that we were already seeing before as well. And the effects of climate change are not felt equally by all. Marginalized communities are disproportionately burdened by the impacts of climate change, despite contributing the least to climate change.
Got it.
Environmental injustice, compounded by social determinants of health, exacerbate inequities that are already existing. These community members are more likely to live in areas with poor air quality, higher risk of flooding, inadequate infrastructure, and limited access to resources, including healthcare resources. As the Planetary Health Alliance states, to realize a more equitable planet requires eliminating specific disparities, including power, wealth, opportunity, or health status, so that no population carries disproportionate, avoidable burdens of environmental and health impacts while others are able to thrive. Providing due equity
Go.
requires recognition that climate change and social inequities are intrinsically linked. And again, we're seeing this here in Minnesota. Climate change, planetary health is a current and increasing public health concern. Minnesotans are concerned about climate change. 76% of Minnesotans state that they are concerned about it. The positive is the kids are all right. Gen Zers, the majority of Gen Zers are hopeful that society will do enough to reduce the most severe impacts of climate change. And 64% think that we should prepare for climate change by preserving and conserving Minnesota's grasslands, forests, and wetlands. So folks are concerned, they want to take action, and they're hopeful that the action that they take will actually make a difference. And this is one of my favorite slides to always share is that really what we're working on and working towards is creating a better future for everyone. And I'll leave you with this quotation. We can't save the world by playing by the rules because the rules have to be changed. Everything needs to change and it has to start today. So I'll pass it over to Tyler. And Tyler, you just let me know when you're ready for me to advance slides. But I'll pass it to Tyler to talk about the Planetary Health Task Force.
Okay. Um, so let's see. Planetary Health Task Force, we put together, I wanna say has it been about a year now? Or am I underscoring that?
I think it's been a little over a year now, actually.
Yeah, I think it was a little over a year ago. We had just started talking about it after I met Melissa at one of our past conferences. And she was telling me about her work and a lot of her professional and academic concerns about public health and planetary health. And it really caught my interest that, another person was that interested, and it kind of sparked the question, how many other people are interested in this being a part of MPHA, and also just about what we do and what we talk about on a daily basis, and especially in our communities and in our society. So um, we came together under a task force because if you know about MPHA structure, just throwing it together and making a committee it just does not happen very quickly. So you have to start small and you have to work your way there. But I think we're doing a good job. We definitely paced ourselves on finishing our charter, and I think it was for the best. I mean, we took our time, and so we had our charter put together, but then Melissa and I came forward as co-chairs of this task force, and um, we got approval to form from our governing council, and that was great. Love that. But really, I think this is a nice opportunity for us to meet people and combine our interests and get other voices in what MPHA could do, what MPHA is doing, and the things that we can continue to do that help with planetary health and help support planetary health. I think for me, planetary health became more of a concern at one of my previous employers, an academic institution that was thinking about cutting their coursework on environmental health and global health as part of their MPH program, just because there was not student interest in it. The enrollment was really low. It was really hard to support the academic staff. And so there was the debate of, do we just cut it? And it was very, very concerning because overwhelmingly, the votes were, well, we should cut it. But the clear opposition was, well, this is a major part of what public health is. It's a cornerstone and a foundation of, public health can't exist without a healthy environment, right? Or a healthy planet. There's only this one planet for us as of right now. And even if there were another one, I don't ever want us to think about like, oh, this one's expendable. So that's where my interest came from. And I suppose Mary or Melissa, I'm sorry, if you would like to forward the slide, see what we have here. So our responsibilities include educations and awareness, advocacy, resource development, sustainable practices, and partnership and collaboration and health equity. What I like about planetary health is our task force has the pleasure of being able to work with every other committee very, very easily. Because if you think about it, every other committee and every other subsection of MPHA is also working towards public health. Um, and I think it's very simple to think about it, since planetary health affects everyone and everything and is thus incorporated by everyone and everything, it just lends itself well for us to be able to work well together with others and collaborate well. So that's really helpful for me. Then you don't have to worry about, do I reach out to this person? Well, of course you can, because it all works out together in the end. We've had a couple of really great educations as well as I don't want to say webinars, but presentations that we've had. Um, and I'd really like to see more of those continue in the future. So if anyone ever has any thoughts about those, feel free to always pitch them. This is by no means a highly selective task force. We're very, very welcoming and very open. Um, and I think, Melissa, if you want to advance a slide. And then do you want me to continue here? Or would you like Dawn to take over? Oh, I think you're muted.
Yep.
I was gonna say we're pretty informal today.
Yeah.
But if you had anything else you wanted to share, otherwise we can turn it over to Dawn if she's ready. But if there's anything else you wanted to share. But yeah, I'll just
Yeah.
echo kind of some of your sentiments that this really was a group of people that came together and saw the connection between environmental health, planetary health, and public health, that this really climate change and biodiversity loss and all the other things that we listed within that planetary health lens. These are all things that are truly are driving public health right now. So it was something that other folks, whether it's the center of your work or just something that you're passionate about as someone who works in public health, that there was a lot of overlap there, and we just really wanted to bring a group of people together to talk about what does this mean for public health, what does this look like in public health, and what are the things that we can do to address some of these concerns.
Yeah, I like to think that this is a task force that is not going to we're not going to tell you that um all of our food is poisoned and like conspiracy theories that you might see online about very very hot topic health claims. That's not this. This is very much like we can acknowledge that there are potentials for like PFAS in our water. We can acknowledge that the weather is more erratic, and that's contributing to higher incidences of vectors and vector-borne diseases. We can acknowledge so much, but we also want to push behind and support the science and the proper health information that goes into public health messaging. Um, we're just concerned about the same things that a lot of people are, and it really helped bring us together. So, but I just always want to be clear, like this is never going to be you're not going to hear quackery from us. We'll never do that to you. Don't worry. So, and I can turn it over to Dawn.
Thank you. Some of my background and why I joined this task
Oh,
force is that's fine. Um, so I got an MPH in global public health from St. Kate's, and so really just looking at kind of a worldwide view of what's happening, and then became environmental health specialist for Dakota County. So I have all these interests. And took a class with Melissa and was like, wow, planetary health. Like, this isn't a new amazing, and I want to know more. And so when this task force came up, I was like, of course I want to join. So I feel like it's been a busy year and we have done a lot as a group. Just wanted to mention, I feel like we're also a pretty diverse group. So yes, there is the local public health representation. This is kind of our jobs. This is what we do. We have interest. But we also have community members, retired community members at that. Students join us, organizations, councils, and sometimes we have someone from another state join. So it's a pretty diverse group, I feel, and just bringing our ideas together. Um, and so, like Tyler mentioned, the responsibilities. So, one of them, the education and awareness, kind of tackled that first. And so, one of our bullet points under that was to curate information, an information hub of planetary health resources. Like you mentioned, webinars, articles, toolkits. So one of the first stabs of this was to develop a web page, looking at taking it like very locally, and we even broke it down what does local mean? It might mean like school board representation, but really like city, county, and then taking it out to the state. So we had this list of what you can do on the web page, and it was a bullet point list, and it got kind of long. And so um, the great web developer at MPHA made this awesome graphic. So just some ideas of what you can do as a person individually, links making it more of a statewide resource, because all of our cities, counties, areas of the state offer something different. But just reminder, look at what your cities and counties offer with this also. So this is, a great graphic that we have. We also have lists of webinars. I don't know if we can go to the web page or I can just talk about it.
I was gonna say if you want
Okay.
to talk about it and then
Okay.
we can at the very end
Okay.
I'll share the webpage then.
Okay. Yeah, just lists of like webinars, trainings, organizations, just trying to create a hub of resources there on the webpage. One of the things we're also looking at is advocacy. So kind of advocating for what locally is happening um, in the Midwest within our state. And so one of the banners on the webpage is for the HERC in Minneapolis. So just information about that. But what we have also dived into more as a group is learning about like emerging issues. So talking more about data centers. What does that mean? Yes, it's a big deal. Yes, we have concerns, but what does it really mean? Sharing resources about the new boundary waters ruling. Like, what does that really mean? So we can, as a group, become more educated on these topics. And are looking to do more resource development, of course, as it comes along. Yeah, that's really all I have for this. You can go to the next slide. I don't know if I'm doing this, but I will just read it. And then if there's more to add to it. And so we would like to welcome you all to join our next meetings. They are the fourth Mondays usually. And so our next one is July 27th, as you see here, 1:30 to 2:30. We also, with the work of one of our members, Hannah, did a lot of work on this design, have created a t-shirt that you can buy. And so just got mine in the mail on Saturday. So I would say order a t-shirt if you want. They're great. And then if you have any questions or want to get in touch with Melissa and Tyler, there is an address there, web address there to get a hold of them.
And then that's the information for if you're not an MPHA member yet. And I think, yes. So we'll open it up for folks to ask questions, comments. So I'm going to stop sharing and then I will pull up the website so everyone can see the website and we can kind of walk through some of those things. But for now, we'll open it up to any questions, comments, thoughts anyone has. Okay, we have something in the chat here.
I was just going to offer to read it if you can't see it.
Yeah.
Okay.
Okay, so Lynn is asking about if we have developed any partnerships or collaborative organizations, and then says the other MPHA committees and task forces list is a great start as they often represent their organizations beyond MPHA in their spheres of influence. Thanks for your answers. So yes, one of the organizations that we have partnered with and are partnering with more and more is Health Professionals for a Healthy Climate, which is another nonprofit group that is a collective of healthcare professionals from around Minnesota that are concerned about how climate change affects affects people's health and well-being. And I know we've got a couple folks that are involved with HPHC here on the call. So I don't know if either of you want to chime in and talk a little bit about HPHC quick.
I can give a little bit more intro to HPHC, I guess. Yeah, what you said is totally correct. We try and help health professionals do environmental advocacy and sort of bring out the public health impacts of various environmental issues. We mostly focus on climate issues, but most environmental issues also have climate impacts. So we do work on a pretty broad variety of issues, but Hannah's worked with HPHC or still works with HPHC on our policy committee. And Dawn also and Melissa um, have been very, very helpful and collaborators. Um, I maybe I'm missing some people, but we're always excited. Oh, how do we become an official partner? Who should we talk to? I don't know if that's in relation to HPHC or to the Planetary Health Task Force. Oh, both. Okay. For HPHC, you can reach out to me or the info at email. I'll put them both in the chat. But we try to provide resources to sort of make it easier for people with healthcare expertise to do environmental advocacy. So we're always excited to help um, bring new people on board. And we do have, I'll also put in the chat an invitation to tomorrow's climate convo that we're hosting on extreme heat in Minnesota. Um, if you'd like another upcoming opportunity to engage.
Yeah. And then Jody, if you want to shoot an email to that Planetary Health Task Force email, we can absolutely connect. Would love to work with you more. That's one thing that I love about this area. Healthcare workers that are working around climate change and planetary health in general. It's a really collaborative space. So one of the things too that we've talked a lot about as a task force is it's not necessarily that we need to do everything, but one of our roles is to connect folks to other resources and to webinars. And so things like the presentation, the climate conversation tomorrow. So that is one of our roles that I think we take really seriously is just getting the information out to other public health professionals so that they can be more well versed in this area. I am going to, I'm going to share my screen again here and show the web
Hmm.
page and my share button disappeared. Thank you all for your patience. I'm usually in Teams, so navigating Zoom gets a little tricky for me every now and then. Uh, is it gonna take me? Okay. It's not sharing what I want it to share. Give me 1 second. I want it to share. Otherwise, if Tyler or Dawn, if you've got, this is what I want. Content only, share. Okay. Are we seeing, can someone let me know, are we seeing the website?
No.
No, it's
Okay, because
fine.
it's probably my desktop. Great. Permission required. Allow. It has stopped. Okay, so I'm not sure if Dawn,
I
you or Tyler can pull it up really quick to see. It's not letting me share it.
so I can once I find where I have it pulled up. It's just I was kicked out last time I attempted to share. So if I am
Okay, yeah, it just kicked me out.
okay. And where are you? Make sure that I have it pulled up still.
I'm going to try while
I
you're
also
doing.
have the struggle of usually work in teams too. So
I'm going to try one more time, see if it'll do it. Entire screen, presenter layout. Go to browser tabs. Let's try now. Let's see if it does it now. Wow, this is really
you are
key.
sharing a screen.
Share. Allow multiple. Allow.
I
Okay.
can see the website that I'm sharing it, but I don't know if anyone else can.
It did come up for me.
Okay.
Fabulous.
Okay. And this is our web page. It is under committees up here. And then we have our chairs, and then here's more contact information if you are interested in getting in contact with them. Our mission, our purpose, our responsibilities, how to get involved. So here's the meeting and a registration here. So you can always sign up from the website. Our wonderful that we put on there, why is it important for me living in Minnesota? The what can I do? And then just some more resources. We're all affected by climate change. Our climate action, the state climate action framework, our lovely graphic. And then we have some more of the local resources, volunteer opportunities, and then get down into like the state, national, international resources. And if someone else wants to chime in.
You're doing great.
Okay. Yeah.
Yes.
That's all I have.
Yeah. Fabulous. And then Jake said the screen is black. Cool.
One thing I've realized with whatever Zoom update this is, it has different tabs along the top of the screen. So it's like meeting view, someone else's screen, someone else's screen. So you have to like go to the top and click to different tab views, which I've never had to do before. So,
Gotcha. That might be part of our problem today,
Okay.
Hannah.
yep.
Thank you. But yes, but essentially that's our big project this last year after we created our charter and our mission and our vision statement. Um, the next piece that we wanted to get into was kind of developing this resource, all these resources for folks. So check out the website again, local, state, national, and international resources for folks to get involved. And that's where when there are webinars coming up or if there's actions that folks can take, we post it there on that webpage. So yes. So yeah, if anyone has any other questions, this was really, we just again wanted to keep it informal and just kind of let folks know that we're here and this is what we've been working on. And yeah, if anyone has anything any questions or anything they want to share, suggestions, ideas for projects, anything, love to hear from you.
I just want to ask real quick, are you mostly kind of focused on the like greater Twin Cities metro area, or do you have partnerships with organizations like in northern Minnesota? Because I'm currently down in the cities, but I'm from like the Bemidji, Grand Rapids area, and there's kind of a severe lack of this kind of information, these kind of resources up there. So I was just curious if that's either something that's already ongoing or kind of on your radar for organizations to look out for future partnerships.
That's a great question. And I would say it's kind of both. So we have folks that join us from around the state for our meetings. So we are a statewide MPHA, statewide organization. We're a statewide task force. We've also had folks from out of state that join us as well. So we definitely want to have this conversation statewide, and we are always looking for new folks and new organizations to partner with as well. So yes, we have folks that join us from outstate. And yes, we're also looking for other organizations to partner with. as well. And to promote it, we want to promote the work of those other organizations as well.
Awesome. Yeah, I'm definitely going to keep all this kind of locked up so that I can share it with other folks who I think might be interested in doing this kind of up in the Bemidji area. So
Excellent.
definitely a lot of good health professionals out there who care a lot about their patients and residents.
Fabulous. Yeah.
I was going to say, I think that's great. And I am also from the Bemidji area. So it is kind of a, you hear about the metro, but state is just so different. Like our state is very different. And so, yes, I think we need to try to reach the whole state and make things applicable to everyone. So,
Yeah, and with advocacy topics too, we try to find things that, yes, are statewide, but then also if there are things that are affecting specific areas of the state too, that we'd like to discuss that and get that information out as well. Anyone else have questions or comments, things to share? Anybody else that's been attending meetings and have been involved with the task force that has anything to share, like takeaways from your time with this group? Or I don't want to put anyone on the spot, but yeah, curious if anyone else from the task force, if you all have anything to share.
I think the one thing
Great
I
question, Lisa. Oh, sorry,
No, you're
Tyler
good.
just got a
Sorry, I can't
question
see any
from
questions.
Lisa Bear. You do not need to be a member to join the meetings. So
Great point.
anyone is welcome to join the meetings.
No, I was just going to say it is incredibly low stakes as well. Like we are not counting attendance when we have meetings. We're really just happy to have people.
Along those similar lines as what Tyler said, I found this to be a great hub to come to just to find information and resources related to planetary health, climate change, and related topics. So, yeah, just show up when you can and contribute and learn, and hopefully come away with some opportunities to, put it into practice.
Yeah, I can echo what Pat said too. I've been with this group for quite a while. I feel like since towards the beginning, it's like I don't remember how I joined or what happened, but like yeah, went through all the charter and then obviously the t-shirts and now getting to see everyone wear them. Mine arrived this weekend as well. So that's just kind of fun to see like we have been doing this for a long time. Yep, you got it. Nice. Um, and yeah, I really like just kind of getting to hear updates from people. It's hard to keep track of all the things that are going on sometimes, but um, it's really good to, yeah, hear from other folks about different things going on across the state and across different organizations as well. So, yeah.
And I think too, just sort of networking and finding community with each other as well. It's really nice. I think a lot of times you can feel like you're the only one, maybe at your organization or on your team, that is concerned about these things. So it's really nice to know that there are other public health professionals that are really passionate about this as well. Anything else from any of our visitors today? Anybody else have any questions or comments?
Yeah, I have a question.
Yeah, great.
I noticed that Jody is involved with food sources, and I was wondering if you had any connection with like farmer groups, or I have worked many years with the Land Stewardship Project, and I just wondered if there was any concerns about soil health and where our food comes from.
Yeah,
or if you have any collaborations with any others.
we don't have any official collaborations at this point. That is an area that we've started talking about more and more. That's an area we would like to get more involved in and get more information about, and then be able to share out that information either through a webinar or a conversation or an agenda item at one of our task force meetings. So that's definitely an area that we have been discussing as a task force. So would love to connect and collaborate with you and with Jody and find
Yeah,
some
I'm
ways
familiar
to
with
work
a number of
together.
urban agricultural organizations. If you want
Fabulous.
me to make, okay, cool.
Yeah,
Just
that'd be
asking.
great. That'd be
All right.
wonderful.
Okay, thanks so much.
Yeah.
And just want to say on our webpage are resources. So this was our start. This is our beginning. So if there are resources out there that people feel would be beneficial, we can definitely add them and continue to grow that portion. So
Yeah, and it's an ever evolving group. So yes, now that we've kind of gotten this project, our charter and our little resource hub, now that that's complete, yeah, we are looking to see what might be next for this group. So and the other thing too, if you have students that you work with or students you're involved with, and I would encourage them to join us as well. We've had some students that have joined us in the past, and then they've gotten connected for projects and practicums, and so we've been able to connect students with resources as well. So that's been really great too. Anything else from anyone while we're still together? Well, thank you all so much. I just want to be mindful of time, and I know a lot of you probably joined us over your lunch hour today. Really appreciate that. Our next meeting, our next kind of official task force meeting with an agenda and a little more structure. We just wanted to keep this loose and friendly today. We are meeting again on Monday, July 27th at 11 o'clock, and would love to see you all there. Bring a friend. For those of you that were interested in sharing some resources, doing some collaborating, please reach out to the email address that we shared. And I think it's on the presentation. I think it's in the chat as well. Would love to collaborate. Would love to see you all again and at our next meeting and future meetings. So yeah, so that's all I have. I don't know, Dawn or Tyler, if you have anything else you want to share before we send people off to the second half of their Monday.
I don't personally have anything else. I just hope everyone's able to enjoy some good weather. It's been rather cold where I've been, so
same here. Just thank you for attending and trying to learn more about what we do. And please join if you're interested.
Yes.
just remember low stakes.
Yeah.
Low stakes.
Low stakes friendly group. Cool t-shirts now too. Yeah.
Sure.
Okay. Well, thank you so much, everyone, and hope to see you all in July. Take care.
Thank you guys.
Bye-bye.